Welcome back. The Ministry of Health and Social Services Pharmaceutical Management Information System of 2023 indicators show that prescription containing antibiotics stood at 45%, which is alarming as it is above the World Health Organization's acceptable target of less than 25%. Executive Director in the Ministry of Health and Social Services, Mr. Ben Nangombe, says there is a need to promote rational prescription, dispensing and use of antimicrobial medication. He now joins us for an in-depth discussion. Mr. Nangombe, good evening and welcome to the show.
Good evening, how are you?
I'm good, thank you. How are you, sir?
I'm doing well, thank you very much.
Thank you so much for your time this evening and joining us. Perhaps just to start with, you can briefly talk to us on what actually antimicrobials are.
Basically, antimicrobials are those medicines that are used to treat bacterial infections, whether it is in human beings or in animals. So that is the simple definition of what an antimicrobial is. They are medicines used to treat microbial infections in human beings or animals.
And Mr. Nangombe, why has there been an increase in the prescription of antibiotics?
Well, there are several reasons for that, and there are studies that speak to the reasons why this has taken place. Some are related to the way in which healthcare professionals prescribe antibiotics. Some are related to the way in which individuals actually state their preferences sometimes to say, please prescribe this antibiotic for me, this is how I feel, and things like that. Some others are related to issues of the systems of healthcare services in different settings. So you'll find that due perhaps to reasons such as availability of resources, the availability of the antibiotics themselves, you'll find that they are readily more made available and prescribed to human beings or to animals. In many instances, for example, when it comes to farming, you'll find that because farmers need to protect their animals, or some individual farmers who may not even know what is it exactly that needs to be done would perhaps go to a health facility or rather to a veterinarian and get this and give them to their animals. So it's a question of use as well that may lead to the increase in the number or in the amount of prescriptions for antimicrobials in a particular setting.
Mr. Nangombe, can you explain to us and to our viewers, what antimicrobial resistance is and why it's a concern for public health?
Yeah, antimicrobial resistance, it just means that a disease-causing microbe, an organism that when it enters an organism's body, tend to cause disease. And if it is causing disease, then that would then mean that basically it is able to do that. And once it has done that, it needs to be treated, right? And the antimicrobial resistance then would mean that the disease-causing organism, through either mutation or what is known as gene transfer, can then develop resistance to an antimicrobial agent that was previously used to treat it. And that is how antimicrobial resistance will then develop against a particular treating agent.
And what factors contribute to antimicrobial resistance?
Say that again, you were breaking up a little bit.
My question was, what factors contribute to antimicrobial resistance?
Yeah, again, it's a question of how the antimicrobial are used. For example, if a person is prescribed a medication, they don't, for example, complete their dose, that would contribute to antimicrobial resistance. If, for example, the antimicrobials are prescribed for conditions that should necessarily not be treated with antimicrobials, then it would also lead to the development of antimicrobial resistance. So it's a number of factors that can lead to that, and it's really a question of public education, so that individuals are taught the importance of the rational use and the responsible use of antibiotics. Otherwise, we are going to see more and more cases of antimicrobial resistance. That is why, for example, last week, Namibia hosted a meeting where we were discussing the issues of antimicrobial resistance as a whole of government and as a whole of society, because it's not only a question of the Ministry of Health and Social Services discussing this matter. As we indicated, this relates to human health, it relates to environmental health, it relates to animal health. Mm-hmm. So it has to be a whole of government approach to ensure that when it comes to these issues, they are discussed broadly, and that stakeholders are reading from the same page.
As you mentioned, public education and awareness is important. So what is the role of public education and awareness in addressing antimicrobial resistance, Mr. Nangombe?
I think it's as simple as I stated to say, when antimicrobials are prescribed for patients, people must be taught about the importance of completing your antibiotics course. That is number one, because if you don't complete your antibiotics course, it would then mean that you have not satisfactorily and completely treated that particular infection. So it is important that the members of the public know this. And I think it's not said enough. It's not said frequently enough in terms of teaching members of the public about the importance of the proper use of antibiotics. Again, it's a question of how we also, when our health professionals prescribe these antibiotics, they should be able to engage whether if it is being used for human health, the people must be informed properly. If it is being used for animal health, also it must be used in a manner that it is prescribed. Otherwise, we are going to see more and more of these cases, and that is what we are trying to prevent.
Just very lastly, Mr. Nangombe, and briefly, what impact could this have on future medical treatment?
Yeah, excuse me, I missed you there.
My question was, what impact could this matter have on future medical treatment?
Yeah, you see, it would, for example, you see that some of the bacteria that have developed resistance to antibiotics, we have, for example, cases of multi-drug resistant TB. So if you have many cases of multi-drug resistant TB, the impact of that on the public health system and on the private health system will be felt in terms of more resources that need to be allocated, greater public education that need to be conducted, and possibly lost lives for people who would then not get cured because they become resistant to treatment. So any form of resistance or antimicrobial resistance that can develop in any disease setting, that is going to have an impact on the general public health in the country. So it is important that efforts are made. Governments need to talk to one another, development cooperation partners need to come in, private sector needs to come in, so that we speak with one voice to promote rational use of antibiotics so that we ensure their effectiveness. Otherwise, we are going to be fighting a losing battle.
Mr. Nangombe, we always appreciate your time. Thank you so much for joining us this evening.
You're most welcome.
That was Mr. Ben Nangombe, the Executive Director in the Ministry of Health and Social Services, speaking to us on the line. We'll be right back after this brief break.